Repeated measurements of a biological variable scatter around the population mean. Individual readings fluctuate from visit to visit. This spread is the empirical basis of clinical reference ranges. Standard deviation quantifies the typical magnitude of that biological scatter. The reference range is defined as approximately the mean plus or minus 2 standard deviations of the population distribution. Taking the square root of variance restores the unit of the original biomarker. The resulting interval describes where most healthy individuals fall in the original measurement unit. A patient's repeated readings over time fluctuate around their individual mean. Standard deviation measures the typical scale of these fluctuations. It treats upward and downward deviations symmetrically. Only the magnitude matters. Standard deviation summarizes the scale of variability, not its direction or pattern. Two patients can have identical standard deviations for a biomarker while following completely different clinical trajectories. One fluctuates randomly within the reference range. The other drifts systematically toward a boundary. Standard deviation does not distinguish these two patterns. Standard deviation is not sensitive to a shifting mean. A patient whose average value is rising can maintain a stable standard deviation throughout. A small standard deviation describes consistent fluctuations around the current mean. It does not flag a trend that carries the mean outside the reference range. Standard deviation improves the interpretability of variance by restoring the original biological unit, but it inherits all of variance's structural limitations. It cannot distinguish a unimodal population from a bimodal one with the same spread. Two distinct physiological subpopulations can be hidden behind a single standard deviation value.